Doorknob questions. Doctors dread them, yet patients keep asking them. But what exactly is a doorknob question at a doctor's appointment? And why do doctors hate them? Why do patients ask them? And what would be a better approach to receive the best medical care that you can? I'm Dr. Lori Creadon Wright, and in my 33 years of medical practice as a family physician, I've encountered doorknob questions countless times. A doorknob question occurs just after the visit is concluded. The doctor has his or her hand on the doorknob to leave when the patient says something like, "Oh, wait, one more thing." In that moment, the doctor knows that the patient is about to bring up the real reason that they are at the doctor's office that day. Why don't doctors like doorknob questions? Unfortunately, the time you're allotted for your appointment is not unlimited. If you wait until the end of your visit to bring up your true concern, it will now either need to be addressed at a different visit, or you will now be using the time allocated to another patient's visit to investigate your medical condition. And almost always, the doorknob question is serious enough that it can't be put off for a later date. So the patients after you that took the time out of their schedule to arrive on time will need to wait. And then they often blame the doctor for not being considerate of their time, when in reality it wasn't their fault at all. If the question had only been brought up at the beginning of the visit, it could have been addressed during the time reserved for that patient. So why do patients ask doorknob questions? There are three main reasons. The first is that they're embarrassed to bring the question up, and as the doctor's leaving the room to see the next patient, they suddenly realize that they've used up their whole visit without asking the question they really wanted to address. Typically, these are questions about changes in bowel movements, blood in the urine or stool, concerns about possible sexually transmitted infections, or questions about sexual dysfunction. The next reason that they wait until the end of the visit is that the possible diagnosis is actually very concerning, and they're hoping that you'll brush it off so that they can go home and tell their spouse or children that the doctor confirmed that it was nothing to worry about. These tend to be questions about having episodes of chest pain, palpitations, dizziness, or memory problems. Of course, these are symptoms that can't be ignored or put off for another visit. The ideal situation would have been to inform the scheduler of the true reason for the visit so that they could book extra time for the appointment if needed. The third reason that patients wait until the end of the visit is that they're afraid that you will tell them that they should go to the emergency room instead of your office for the symptoms that they're having. Most people have a much higher emergency room copay with their insurance than they do for a doctor's office visit. So they may book an appointment for something minor like allergy symptoms. Then at the end of the visit, they reveal that they're currently experiencing chest pain, shortness of breath, dizziness, or weakness on one side of their body. Often we have to call 911 in the office to have an ambulance transport them to the nearest ER, as time is of the essence in these life-threatening conditions. We doctors aren't simply annoyed that doorknob questions keep other patients waiting. We are genuinely concerned that you're putting your life at risk with this strategy. So what should you do instead to receive the best possible medical care? First is to be straightforward with the medical receptionist as to the reason you're seeking medical care when you call to make the appointment. This will allow them to allocate a proper amount of time for your visit, or even direct you to an emergency room if the condition is potentially life-threatening. Second is to tell the nurse or medical assistant your true concern as they check you in. This will allow them to triage what needs to be done first. If you say you're short of breath, for example, they'll likely put a pulse ox on your finger to check your oxygen level. If it's normal, the workup will likely continue in the office. But if it is low, they will likely notify the doctor immediately, start oxygen, and call 911 to transport you to the nearest ER for further evaluation and treatment. Lastly, don't be embarrassed to discuss your symptoms and concerns. We are medical professionals, and it's very unlikely that you will bring up any topic we haven't seen multiple times before. While it might seem embarrassing to you to say that your poop has recently turned black and tarry appearing, to us, these symptoms raise a red flag that you could be experiencing internal bleeding in your upper gastrointestinal tract. By letting us know your true reason for the visit right from the beginning, you'll be able to receive the best possible medical workup for your concerns, as well as to show respect to the patients who are scheduled to see the doctor after you. The U.S. healthcare system can be confusing and sometimes frightening. I hope this video helped you understand the best way to go about getting a medical concern addressed in office. If you would like some pointers on how to select an insurance plan, please click here. If you'd like tips on living the life you would die for, please click here. And if you would like to be notified when new videos are released, please subscribe to my channel. Thank you.